Hi, Namaskar. I am Dr. Yogalakshmi, clinical hematologist. Today I will just tell some basic things about stem cell transplantation or bone marrow transplantation. Bone marrow transplantation and stem cell transplantation are almost one and the same. That is, the stem cells from the bone marrow is transplanted during bone marrow transplantation, whereas in stem cell transplantation it can be done in the peripheral blood also. That is, the stem cells from the bone marrow are mobilized to the peripheral blood, and from the blood the stem cells are collected and transplanted to a patient. And the stem cell transplantation is of two types. One is autologous transplantation and the second type is allogenic transplantation. Autologous transplantation is done in some diseases like multiple myeloma or sometimes in lymphomas which have occurred after the treatment or which is not amenable to the treatment. In those cases, we go for autologous transplantation. Autologous transplantation is a process in which the stem cells are collected from the patient, and after giving some kind of chemotherapy to the patient, these cells are again retransfused to the patient. So this will control the disease, this will eliminate the disease causing cells in the bone marrow, whereas the normal stem cells which are collected are again retransfused so that the patient will have again blood production. So this is the process of autologous transplantation. Whereas in allogenic transplantation, usually the cells are collected from another human being and then given to the patient. Whereas that human being who is donating can be sibling, can be a sibling where it can be matched fully, which is called as matched sibling donor. It can be sometimes in the form of unrelated donors. If there is no HLA matching between the donor and the recipient, that is the patient, then it can be done in the form of unrelated donors, where the HLA 10/10 match will be there in the donors who are not related, whom basically we don't know who are the donors, but that will be from some stem cell banks where they registries where they collect the stem cells and give to us if there is a match. And one more thing is called as haploidentical transplantation. The haploidentical transplantation is usually done from either the parents or sometimes the siblings also can be a haplodonor, or sometimes the children can be a haplodonor. So there will be a half match, that is 5/10 HLA matching, in which only one set of alleles will be matched in all the antigens, and that can be transfused when in some diseases we prefer haplo, and also in sometimes when we are not having a donor, apt donor in a related patient or in an unrelated patient, full match is not there, but the transplant is required and emergency procedure, then that time we can go for a haploidentical transplantation. All these procedures before transplantation, the donor and the recipient have to undergo some basic tests. If they are fit enough, then only they can donate the stem cells, and after that the transplantation is carried off. So this is a short procedure how transplantation is carried out, but apart from that there is a long process after the conditioning regimen and after the stem cell transplantation. There is a long recovery period which I will cover in another video. Thank you.